Hi, I'm Dr. Adam Miller from Arise MD, board certified oral and maxillofacial surgeon, as well as board certified in integrative and functional and anti-aging medicine. Here to talk to you about something that by conservative estimates affects 1 in 5 people in America today, and that is anxiety. And I would argue that everyone has experiences with anxiety at some point. And at the outset here, I just want to tell you that we're going to take a few minutes, 10 to 15 minutes or so, and walk through what I think are the different portals of entry, therapeutic portals of entry, for helping to reverse this hypervigilant, inflamed state that we all know as anxiety. You know, it's a feeling that we experience, it's an emotion that the world just isn't all right. And one of the molecules inside of us, the neurotransmitters that's associated with that feeling pretty strongly, is serotonin. And in the absence of adequate serotonin stores, the general feeling is that the world around us isn't all right. And it makes me think of Einstein and a moment that was recorded in one of his students' journals about the question that should be asked at the outset of any experiment. And Einstein looked at his students and said, that's easy. The number one question that any student should ask prior to starting an experiment is the universe a kind or an unkind place? That shapes your lens on everything else you do. And when you're feeling anxious, you feel like the world around you, the universe isn't so kind, things aren't okay. So we do 3 tests up front for anyone in my practice who says that they're battling anxiety. And I want to give you some justification for those 3 tests and share with you a few suggestions in each of these domains that I think if you're not already doing, you should consider to help curb and manage anxiety. And I'll tell you that at the outset the therapeutic discussion, whether it's the gut, and this is the small intestine represented here, or the brain, or the stress response system, the adrenals and cortisol production, one therapy that's had huge promise recently that is working, I believe, in all 3 of these areas simultaneously is CBD, or non-THC hemp oil. And we've done 2 years of research on that with our citizen scientists in our practice to show that it appears to be causing a shift in the gut microbiome. It helps referee that hypervigilant state, or the overfiring of neurons up in the brain, or even in the second brain, the enteric nervous system, as well as the overstimulation of cortisol. So if you need to jump off and you don't want to watch the rest of this video, I would say that if you're experiencing anxiety, generalized anxiety disorder, especially during this pandemic period, and you haven't tried a 25 milligram gel cap of our CBD hemp oil twice a day, then I'd recommend that you get on the store and go ahead and purchase that and at least start there to try that, especially in women. We've seen it in men as well. But if you have any degree of irritable bowel, issues with anxiety, insomnia, poor mood, and feeling of cortisol rushes, or just chronic stress state, hemp is a great solution for many people in that regard. So let's walk this through. And again, we want to look at the different portals of entry for contributors, I should say, for anxiety, which I consider to be a hypervigilant state. The first one I want to talk about is the gut. And the reason is that we know that the 500 and some species of bacteria that are in your gut, some of them produce serotonin, neurotransmitters. Some of them make the B vitamins that are needed for your stress response, for that feeling that you're fortified to take on the world. Some of them also influence the enteric nervous system, that second brain that's lining the gut. And through our gut testing, we like GI map for this, we can look for signs of leaky gut through testing zonulin. We can look at inflammatory markers to see if the gut is inflamed. We can also see the composition of bacteria in the gut, what we consider just your microbiome, as well as any infectious organisms. It isn't uncommon for us to see candida or yeast here. We also see parasites on occasion. But those are the key markers. And if you have leaky gut, we have gut healing protocols that include things like glutamine and aloe and DGL and other proven healing agents, as well as prebiotics and probiotics. If you're inflamed, we have anti-inflammatory programs that include things like curcumin and quercetin, which is an antihistamine. And then the microbiome, we really look hard there at what specific organisms you are deficient in or have overgrowth in, so that we can shape certain natural antimicrobials. Of course, we love oregano and garlic, in addition to the prebiotics like inulin and other fibers to help fuel the healthy bacteria, because we know that most of us are throughout the week in the modern era experiencing higher stress than our ancestors had. And we know that when you experience high stress, when you perceive that external events are continuously threatening to you, we can see shifts in the microbiome that literally chronic stress becomes poison pen letters to the gut. And those bacteria shift. We see things like lowering of bifidobacter and lactobacillus levels, the rise of enterococcus. And those shifts in bacteria lead to more anxiety, fatigue, and, believe it or not, memory issues. We also know now that in terms of therapies, that certain bacteria are known to contribute to an anti-anxiety protocol. For instance, Bifidobacter infantis helps not only repair the gut, but it's also a serotonin producer. It helps produce that neurotransmitter that makes you feel good. Lactobacillus casei helps reduce anxiety, as does Lactobacillus rhamnosus GG help reduce anxiety. So there are now, in this era, probiotics with these specific bacteria that can help treat anxiety. Let's go back to the gut here for a minute and just recognize that 70% of the immune system lines the gut. And if you have an inflamed, leaky gut, you most likely also have an irritated and leaky brain. And along with that, have the sensation of anxiety. It's a constant sense of friction. Well, a lot of that comes from inflammation down here in the gut. The gut influences the immune system, where, again, 70% resides here. And it also influences the higher brain centers where we process and experience emotion. Now, remember that breathing is critical. I mentioned CBD being a central therapeutic element here, but so is breathing. We know that when people are focused and they're stressed, they're holding their breath. They get a rigid diaphragm. And when the diaphragm is rigid, the vagus nerve isn't getting that physical activation that turns on the rest and digest nervous system, known as the parasympathetic nervous system. So one of the hacks, in addition to CBD, is coherent breathing, counting to 5 as you breathe in and anywhere from 5 to 8 as you breathe out. A slightly longer exhalation is better than a shorter exhalation. So the vagus nerve activation through breathing is another hack. If the GI map gut test helps us identify zonulin levels, inflammation, the state of your microbiome, and how well you are digesting foods, would be the last one that I see as a big contributor for this diagnostic, then the urine and saliva collection that we recommend through NeuroLab gives us your levels of some key neurotransmitters like serotonin and GABA. And the thing is, when you are perceiving a lot of stress in your life, especially during the pandemic, a lot of people are experiencing higher levels of stress. You are most likely releasing higher levels of cortisol. The stress response system, the adrenal glands are meant to produce cortisol and DHA and adrenaline for about 15 to 30 minutes. Anything after that, we start seeing damaging effects. We see plaquing of arteries through the movement of calcium from the bloodstream into the artery wall. We see the confusion of lymphocytes, particularly T lymphocytes, which puts you at a higher risk of infection and higher risk of cancer. Lastly, we see a swelling of the hippocampus, the memory center in the brain, would put you at higher risk for dementia. But we also see in high cortisol states, we also see a lowering of hydrochloric acid in the gut, which means digestion is now strained. 20% of your digestion should happen up in the mouth and another 20 to 30% here in the gut. And under stress, you have a lowering of hydrochloric acid, which means you're getting less digestion. You also, as you know from public speaking probably, get a dry mouth. So cortisol directly influences the ability for you to break down food and get the nutrients you desperately need to fortify the adrenal glands and the cells of your body to withstand the pressures of stress in your environment. Well, every time your adrenals produce cortisol or DHEA or adrenaline to buffer or protect that memory center in the brain, your brain and your gut will produce serotonin and GABA as a buffering or offsetting element. Well, as you can imagine, over time and as stress goes on, you start to burn out these levels of serotonin and GABA. And I jokingly say that GABA stands for get another beer already, because low GABA states and chronic stress is why at happy hour it's so easy to drink those beers. You're replenishing your brain's GABA stores or turning on the GABA receptors with alcohol. And so it's the right strategy, it's just the wrong tactic. With the stress testing, we are looking at cortisol levels. We're also looking at your 24-hour cortisol curve to see if your daily or diurnal rhythm is appropriate. We're looking here at DHEA, and then we're looking at the neurotransmitters as well. I also, in those stress hormones, am looking at the sex hormones in conjunction, because during chronic high stress, high cortisol, high anxiety, you tend to have lowering of testosterone and a shift in sex hormones. So where can we get a competitive advantage tomorrow? Well, without the testing in front of you, you're shooting blindly. However, a good, well-rounded probiotic that has some of Bifidobacter infantis, some Lactobacillus casei, and or some Lactobacillus rhamnosus, GG, would all be helpful in reducing anxiety, as well as feeding the good bacteria in your gut with adequate prebiotics. Fermented carrots, fermented beets, sauerkraut, a variety of vegetable-based fibers, including, I believe, every adult, anyone say over 25, should be taking some daily fiber supplementation. If you're looking to lose weight, we like OptiFiber Lean from Zymogen Corporation, but there's a whole host of probiotics out there. I've given you some guidance on what bacteria you want to look for in those probiotics. And then if you have signs of irritable bowel, you are 1 week you're rushing to the restroom and having loose stools, and the following week you've got constipation, clear signs of irritable bowel syndrome, you probably have ongoing inflammation. And in our practice, many of those people also have some level of anxiety. And to help regulate that gut, we recommend a good broad spectrum probiotic, as well as consider yourself struggling with a stressed gut. We'd recommend that you start a digestive enzyme that has some of that hydrochloric acid in it, which is known as betaine, B-E-T-A-I-N-E. Now, for serotonin support, many people will respond positively to evening doses of about 50 to 100 milligrams of 5-HTP to help support serotonin. There are also products that help support GABA. One that we like in particular is Relax Max from Zymogen. We also like a formula from our lab partner called NeuroLab. And then there's Kava, which is a root from the Pacific that is known to help raise GABA. Deep non-REM stage 4 delta wave sleep raises GABA, as does exercise. And then when it comes to stress management, certainly as we've mentioned, getting control of gut inflammation can help cut down on leaky gut or heal the gut. And if you cut down on leaky gut, then you're cutting down effectively on the low-level sepsis state or bacteria in the bloodstream that are getting through, which over time turns on through inflammation, the adrenal response. So in order to reduce cortisol levels, you very often have to deal with the inflammation in the gut. Most patients need some support with DHEA. 5 milligram tablets once a day usually work well there. And then vitamin C to help support the adrenal glands would be used in our practice very commonly with a whole host of adaptogenic herbs. things like rhodiola, ashwagandha, phosphatidylserine, holy basil. All of these are ways to help mitigate the triggers for the stress response system in the adrenal glands. So whether you are repleting probiotics that are known to help reduce anxiety, or you are effectively reducing the cortisol response from the adrenal glands with adaptogens, with breathing techniques, um, or you're working to help support your neurotransmitters like serotonin and GABA that have just petered out or burnt out and are no longer offsetting the anxiety producing effects of chronic high cortisol, you have multiple portals of entry. And the way to, I believe, accelerate your treatment, your healing, your recovery, uh, and reduce anxiety ultimately would be to do the GI map and the neuro lab testing to get a look under the hood at the dashboard at your particular state of affairs with your gut health, adrenal health, and neurotransmitters and brain health. I'm Dr. Adam Miller, and we recommend that you start with a 15-minute consult with me to run through your history and to make sure that you are on the right track in terms of how you're spending your dollars and your time. But if you want to just get going today and you've seen this video and you say, you know what, I really want to get this testing and figure out my anxiety issue, then you can go to our store, arisemd.com, and you can purchase the GI map and the neuro lab test kit without seeing me. And then once you have your results, if you want to do some homework and then get your consult, that's fine. Additionally, if you're interested in the CBD oil, you can purchase that at arisemd.com, our store as well.